Welcome to the Licensed Ally Expert Series, where industry experts provide helpful insights and information to help you stay up to date on relevant issues for mental health professionals. I'm your host, Dr. Chris Stack, licensed psychologist. I'm excited to have with me today Dr. Kia Yang. Dr. Yang is a licensed psychologist in California. Thank you for being here, Dr. Yang.
Thank you for having me, Dr. Stack. I'm really excited to be on this podcast to talk about the Hmong culture.
Great. We're very grateful that you're here. Dr. Yang is a Hmong American and will be providing information on the Hmong culture, traditions, and how to work with Hmong people in a therapeutic setting. This video can count as continuing professional development hours for licensed psychologists in California under the self-directed learning activity. It can also count toward the cultural diversity, social justice hours requirement. After the discussion, instructions will be provided on how to log these hours onto licensedally.com. Dr. Yang, take it away.
Okay, so as you mentioned, I'm Dr. Kia Yang. I'm a licensed psychologist. My close family members call me by my other name, which is Va, and it is translated into a bamboo basket, a winnowing basket, which is typically used in the Hmong culture to kind of separate the husk from the actual grain of rice. And I bring that up because the way I got my name was actually, so I was born Kia because my parents wanted me to be a happy, calm baby, but I was the opposite. I was very fussy, really troublesome. And so my grandpa, who was a shaman, went into the spiritual world and he talked to my spirit, and I wanted the name Va, which, like I mentioned, translates to a basket in Hmong. So I grew up wondering why, of all names, did I pick a winnowing basket? My mom couldn't really explain it to me either, but as I grew up and I learned more about my Hmong culture and got into more of the academia, I came across the funeral rites, and winnowing basket is actually a really critical part. The galva is actually used to carry the items of the deceased person and actually take its soul and guides it to its home and the afterlife. And so that's kind of symbolic of my job, which is to help guide people to be the most authentic and happiest version of themselves. So I just wanted to kind of start off with that introduction.
Oh, that's great. And I have to ask, behind you, there is a basket looking thing. Is that a va? Is that how you?
Oh, yes. You're very observant. You made that connection.
That's awesome.
I did that on purpose to tell my story, and I totally forgot that. But yes, behind me is a va, and I have it there kind of as a inspiration, so I can see it every day to remind me of my work. So the playing basket in its highest spiritual form becomes the gova to help and guide people. And so I like seeing it on my way to work.
That's awesome.
Yeah, thank you. And so with that being said, I've always kind of been born into like this Hmong community filled with a lot of spirituality. And so with that being said, we'll get into that a little bit more, but I wanted to talk about the history of the Hmong people. Historically, the Hmong people have a history of being displaced. There's a lot of immigration trauma, starting from China. In the text and research, there's no real understanding of where the Hmong people come from, but we know that the Hmong people originate in China, and then through war and displacement, we end up being dispersed throughout the world. So in 1975, the Hmong people were recruited by the CIA to participate in the secret war in Vietnam. And after the United States kind of came out of the war, the Hmong people were left there to kind of fend for themselves. And because of the genocide, the Refugee Act of 1975 allowed the Hmong people to emigrate to United States and other countries in the world. With that being said, they had to go through a lot of dangerous and treacherous journey to get to the refugee camps, and then ultimately emigrate to different countries.
Yeah, I think we sort of talked leading up to this, and I've let you know that I know very little, if anything, about Hmong culture and traditions. And even when I tried looking it up, just trying to discover what region Hmong people come from, it was somewhat vague. It just said sort of in the China area, but it didn't really give it many specifics or anything. So it sounds like maybe even among Hmong people, there's not really any clearly defined region or territory that maybe.
Yes, yeah, you're correct. And if you ask a Hmong person, it's really hard to pinpoint the origin. The question that I would get a lot growing up was, where are you from? Where are the Hmong people? And it's a really hard answer because there's no country that you can really say that it's a Hmong country, because we are displaced and dispersed throughout the world. There's a large population in the United States and France. My dad, when he left the refugee camps, he actually emigrated to Hawaii. So kind of, and my mom was in, I think, Alabama, but everyone kind of wanted to be with their kin. So community is really huge for the Hmong people. And so from Hawaii and Alabama, these Hmong people that were dispersed throughout the states kind of gathered together and emigrated to California, which was one of the hubs, the major population of Hmong people. The Central Valley also had a lot of opportunities for farm work, which was, really something that the Hmong people were really familiar with. And then from California and the Central Valley, then a lot of Hmong people moved towards the north near Minnesota, Wisconsin, where a lot of the jobs were at. So two of the biggest populations of Hmong people in America are in kind of Minnesota, Wisconsin area, and then here in California.
Oh wow, that's really interesting. I lived and worked in Hawaii briefly, and there's a large Asian population there. Are Hmong people heavily populated in Hawaii as well, or is it primarily the mainland U.S. here?
It's probably the mainland U.S. now, because I asked my dad, why did you leave Hawaii? And so, but I guess if he hadn't left Hawaii, then he wouldn't have met my mom. And so I think a lot of them emigrated to California and the Central Valley to be closer to family. But I wouldn't be surprised if there are still a few families there.
That's great. You mentioned some religion background. Can you maybe touch on the Hmong religious beliefs and spiritual beliefs?
Yeah, sure. I'd be glad to. So shamanism is a huge part of the Hmong culture. It is the belief that there is a spirit in nature and the trees and like basically anything that you could come into contact with. So a shaman is the spiritual healer of the community. And so what that means is that whenever someone has a sickness or an illness, the shaman would go through a trance and then be able to retrieve the person's lost spirit or soul to help them feel better. So the shaman is a really, really important figure in the Hmong community. And to become a shaman is a very arduous process itself. It means you have the calling from the spirit to heal people, to give back to the community. You go through certain rites in order to become a shaman. And so shamanism is really integral to the Hmong community. So part of the the immigration to the United States means that Christianity was introduced to the Hmong culture. So we do have shamanism and then Christianity and other religion as well. But kind of going back to like the kind of the origin of like how the Hmong people came here. I mean, from kind of what I'm saying, almost every Hmong person in the United States right now is here because of war. And so I really want to paint the picture of just how that contributes to like how the Hmong people are doing nowadays. So many years ago, I did a research. I wanted to record the stories of the elders and their experience. And one of the recordings I remembered was actually my dad. He was telling the story that if you can imagine living in a mountain, really secluded, having no access to radio, television, or the news, and you're surrounded by nature, you have your farm animals, your farm, you're living in a hut, and you have no idea that there is war in other countries, and you're just living your life. And one day, soldiers come into your village and they're trying to take your animals, forcing you to feed them. And that was really a rude awakening for the Hmong people. So it's kind of like that shift from this very secluded life into life in America, which was a drastic change. So that kind of sets the tone and the context of what I will be talking next, which is Hmong mental health. Do you have any questions before I get into that?
No, I mean, I think you, again, leading up to this, we talked a little bit via text and email, and you had mentioned, some of this trauma, cultural trauma, is that stemming from maybe this displacement and the warring elements. It just sort of disrupted and displaced many of the Hmong people. Does that still spill over, I guess, into today among the Hmong society, that kind of scars from those wounds?
Yeah, absolutely. The displacement, the oppression. I mean, Hmong people are really known to value freedom and that independent lifestyle. And so when it comes to oppression and displacement, that is a huge factor into kind of the issues that we see today. Not only that, Hmong people have a really strong spiritual root. And so going through all of the displacement, the war trauma, the immigration trauma meant that a lot of them couldn't bury their dead or their loved ones. And so for the ones that made it to America, it meant a lot of guilt, a lot of shame, a lot of depression, because they weren't able to give their family members the rite of passage back to into the afterlife, to be reborn. And so that is also part of it too. And so, like I said, most Hmong people are here because of the war. And so growing up, even if you weren't directly in the war, it almost felt like you were part of it, because it was the stories that you heard around you from your uncles and your aunts. And then also seeing them suffer because of PTSD. Some family members I talk to say that they still have nightmares of being chased by soldiers in the war. And no matter what they do, they just can't escape. And so the past definitely does impact the future and the present. But I think a really critical part of understanding that is, that even though there's this trauma and this layer of guilt and sadness, there's also the part where there's resilience and persistence and not giving up And I think if we can also draw on that to help when we have Hmong patients or clients, it would be really, really helpful. I see also a lot of young people nowadays kind of looking back for, ancestral wisdom. A big thing for me right now is decolonizing therapy. And I think that's also a lens that really helps to kind of, when working with the Hmong people, the youth is kind of looking back to research more on ancestral wisdom, which is the grit, the perseverance, also the holistic healing, the peace in nature. And then, I feel like a great metaphor for this is as the youth is looking to the past, they see their own ancestors looking back at them, because it's an opportunity now to be able to heal from the trauma wounds. And, we do that by speaking up, by not allowing ourselves to be oppressed, and for us to understand that, with the Hmong community, the way to healing is kind of really community based. It's not what we typically would, kind of think of in Western terms. I hope that makes sense.
It does. And so that kind of makes me wonder, as a therapist working with a Hmong client, what would be an effective treatment modality? What would work, what wouldn't work? I remember in grad school when we talked about Native Americans and the importance of tribal elders, and that occasionally tribal elders may even want to be a part of the therapy process with someone else. And in the United States, that kind of raises some HIPAA questions and all sorts of various other ethical quandaries. But for the Hmong people, is it sort of similar that maybe it's sort of like a family effort, sort of, so to speak, to all work together to help this person? Then how would that play out in a therapy setting?
Yeah, I mean, there is right now not a clear answer on how to do that, because individual therapy hasn't actually been a really hot topic for the Hmong community. And maybe it goes back to that piece where community has always been a really, really important part, but then we also see the value in individual therapy, because there's also diversity within, the community itself. And so we have probably the more traditional older generation who will benefit more from like the community based. And then we might have the more modern Hmong people who are open to individual therapy. So it's kind of getting an understanding of like that piece. So in Fresno, the thing that I've seen that's been really helpful is actually organizations who do more community-based outreach, and organizations and things like that, and involving like people in kind of like community-based interventions. But yeah, I do see the value in individual therapy, and the possibility for getting the elders involved is it's definitely in the right direction. But even with that being said, Hmong people are also really particular in who they choose to be their healer. And so it comes with a lot of nuances when working with Hmong people.
I was actually gonna, I was hesitant, but I was thinking about asking a question. If this may surprise you, but I'm a white guy. If that would impact a Hmong client, I would that be something that they would be turned off to, and they would seek a Hmong therapist, or more likely to seek a Hmong therapist because of the cultural implications and the understanding and sort of this common experience, at least ancestrally, maybe make them more comfortable, easier to build rapport, or maybe this perception that they would understand their worldview better. Does that sound like it would ring true, or is that maybe my off base with that?
No, you're not off base. I think definitely someone who has that cultural understanding. I don't necessarily think that they have to be Hmong. It hasn't. I mean, the research kind of shows that um, for I think the Asian community and Hmong community, the race of the therapists, um, is not a huge factor. But definitely the cultural competence part is really important because um, if we're talking about the the decolonization piece where you're trying to draw on like the person's kind of history, when it kind of like epigenetics and like that history of trauma that's kind of um, passed down intergenerational trauma, having that understanding of oppression and how you interact with the patient would be really helpful and beneficial for them. And I mean, this is not an example for like for therapy, but even like a monk person who's had that history, who's lived experiences, um, displacement, oppression, um, and having someone kind of take credit for their idea or having someone who kind of disregards their thoughts kind of might trigger those feelings to come up again. So I think that's a huge part to kind of understand the context of like where your Hmong patient is coming from, because even if they do decide to do individual therapy, they still have that history, that background that would be really important.
And you sort of mentioned that maybe more modern or even younger people in the Hmong culture, they might be more open to the whole idea of individual therapy. Are there any particular modalities that would be more beneficial than others, maybe, or is it more just client specific, depending on what's going on?
I think it would be more client specific. Um, and say that because there hasn't been, like to my knowledge, a lot of kind of outreach when it comes to the information on like what a psychologist offers. I think if you do your own research, you might be able to gain that insight and knowledge and seek someone else out and want a specific modality. But it hasn't been something that is that the outreach is. I mean, the outreach is definitely lacking in that area.
Hmm. It's interesting. Something, maybe a research opportunity for people listening. They can get involved and um, see what works best for this particular group of people. So you're Hmong American, and how, I guess, did your family respond to you pursuing the psychology route and becoming a therapist? Was there any pushback? Were they supportive? What was their reaction like?
Um, I think just knowing I was getting a doctorate was a really good thing. Understanding psychology and what a psychologist is probably a different story, but I think like a lot of my family members have been in mental health systems and in one way or another and have come in contact with the psychologists. And it's usually not among psychologists, so they never really knew what they were actually doing. Um, but I think now that they have a better understanding of psychologists, and I do have some experiences with elders in the Hmong community. I think I mentioned to you, I recently went to Minnesota and I was visiting a family member, and then there was a shaman who was there. And when he found out I was a psychologist, he asked me for help. And I was really, really shocked and surprised because I was thinking he might have some insight for me or something he wanted to share. And actually, he was asking for my assistance. And so I thought that was really interesting and um, and a really, great experience to have. And it kind of made me think a lot about like the healers in our community and how they also need help and need support too, because it is a huge burden to kind of walk that path, the path of being a shaman.
Yeah, and so one thing that you also mentioned leading up to this was just a brief note about community integration rituals. And so, speaking of the shamanism and the community, can you speak to that a little bit more? Maybe the rituals aspect.
Yeah, I mean, sometimes I feel like it's been a privilege to learn about psychology and to have gone through the program. Um, and I can see like some of the parallels with even like spirituality and Hmong shamanism. When it comes to trauma, there's a term that Hmong people use, and it means like the spirit kind of blocks off the heart. And so what a shaman would do, or, in depression, when someone manifests like those symptoms of, isolation, sadness, they don't have the term, but, they kind of see it as the spirit being lost or wandering. And so what a shaman would do is they would go into the spiritual world and retrieve the spirit and bring it back to the person and kind of merge the two together, kind of the fragments, and unite the two. And so in some ways, I think kind of supporting, if our patients are believers in like shamanism, supporting them in that area, I think would be really good. And so, I mean, under our scope of practice, we can help them explore like what it means to them when it comes to like depression and sadness, whatever their mental health issues are, and then asking them, would it be helpful for them to kind of engage in one of those practices?
Yeah, that's really good, and it's just so important to treat the individual, and regardless of what culture they come from, people are still going to have their own set of beliefs, and they're all going to be different and individual, and you really have to tailor your interventions appropriately. And so obviously if someone doesn't believe in shamanism, even if they're Hmong, I'm not going to refer them to a shaman or encourage them to go see a shaman. So yes, very important to do that. You also mentioned some stigma and shame. Was that in the context of the displacement and that cultural identity kind of almost getting stripped away, or was there more stigma and shame with actually seeking out treatment for mental health issues?
Yeah, we did a study, and maybe about 5 years ago, and stigma and shame was one of the reasons why people didn't want to seek help, and it was more towards like family members, the stigma that their families would judge them, or would see that they weren't doing really well. And so what happened was they Hmong people wouldn't seek help until it got to where their symptoms were really severe, and that's when they would seek help. But yeah, stigma and shame is something that really hinders help seeking behaviors.
Also, sort of mentioned this importance of returning to harmony, and I know you talked about maybe these spiritual fragments, I think, as you describe them. But in terms, again, of the mental health part, you said it's not just the symptom reduction, it's that return to harmony that would be important for a Hmong client or Hmong patient. Can you elaborate on that a little bit?
Yeah, so I mean, in the Asian culture, there's a big emphasis on balance. So when a person is not balanced, they're more prone to feeling sick or even having mental health issues. So the return to harmony, really means finding ways to kind of find balance in your life, whether it is, I mean, when we apply it to kind of modern days, it goes back to what I said earlier, which is how do you balance like your cultural values and expectations, and then also who you are now in modern day America. And sometimes it could be disharmonizing. You're wanting to be independent, pursue goals and job, and then the cultural expectation is that either you have kids or become a wife or get married early or don't pursue your goals. And so it's kind of finding how to harmonize that as you're navigating through like your own life.
And so what you just mentioned there, among women, is that that sort of traditional patriarchy structures that part of the culture as well from a traditional perspective of Hmong women?
Yes, traditionally it is more patriarchal, but Hmong women are more successful now. They do hold a lot of higher paid jobs. And so we notice the Hmong men, their mental health is actually declining more than the women, because a lot more emphasis has been on empowering the Hmong women. And so I think, for future directions, the focus can kind of shift gears a little bit towards the Hmong men.
Yeah, and I'm guessing that a significant portion of that also is that stigma and shame that we just talked about, and maybe among men, especially in the culture, that they're hesitant to go out there because of that stigma and shame. And frankly, I think that's across the board in a number of different cultures. The stigma and shame among men in seeking treatment for mental health issues is viewed as weak, and as if it's just not ideal to get help for what you need help with. So what about accessing mental health among Hmong people? Is there language barriers, socioeconomic barriers? How does that look for Hmong people?
Yeah, definitely. I mean, historically, if you really think about it, my generation is the first generation of Hmong people to be born here in America and speak English fluently. So it means that all the generations before really couldn't communicate. So that means they couldn't really even participate in therapy and mental health treatment. They really didn't understand what it was about. And so it was hard to access those services. And even if they did, they really didn't know what they were participating in. I mean, now there's improvement and progress. We have organizations like Firm, and then Hopeful Encounter, the Fresno Center, who are kind of bridging that gap and reaching out to the community to provide those services. But in the past, it was definitely, access was hard to find. And so I think it goes back to kind of, I mean, talking about this topic and being and having that knowledge that, this is really the first generation where we were able to speak English fluently to kind of talk about these issues. So part of it is also now we have that opportunity to bridge that gap, to bridge that mental health literacy, to advocate for more mental health treatment for our elders in our future as well, and to talk about it, because our elders really didn't have the opportunity, even if they wanted to, because of that language barrier, like you mentioned.
Yeah, and that sort of balance. You talked about harmony, but I mean, even in the treatment context, you're talking about this ancestral component of this ancestral wisdom of the cultural background of Hmong people and their beliefs, and then modern advances as well. And I know you mentioned harmony in the sense that they're trying to find harmony within themselves. But then even as a treatment provider, we need to find that harmony, that balance between that culturally sensitive ancestral beliefs and knowledge and the modern advances that we have. Do you have any tips and advice for therapists trying to be more culturally competent for Hmong people, how to make that harmonize and really integrate the two?
Yeah, for the patient or the therapist?
I think maybe for the therapist, I think, because I think the patients, it would sort of be more specific to them and their own personal beliefs and whatnot. But for a therapist who is trying to balance those for their client, is there any advice or recommendations how to do that?
Yeah, I think so. Like it's kind of introduce myself. I grew up in the Hmong culture in a very collectivistic community. The things I do is very connected to my family. Becoming a psychologist, even though my family didn't really know what it was about, it was actually really it was actually inspired by my dad and my mom. And so there's that connection. I didn't just do it for myself as a person. I did it for like my community. And so I remember talking to another psychologist friend, and my dad had passed away at this point. And I was talking about how I was confused because I had done this partially for my dad. And I was trying to find, what is my reason for continuing to become a psychologist. And I remember the psychologist said, well, you don't do it for your dad, you do it for yourself. And I remember just thinking, wow, that really sounded so weird. It doesn't resonate with me. But if you're saying that, that must be true. But it took a lot of, becoming, knowing myself, drawing on my experiences, becoming a psychologist for myself to realize that, there are differences when it comes to like one's approach to therapy. If you know the people, the Hmong people, and kind of you also self-reflect, then sometimes you might be more open to different ideals, different ways of healing. So I think the way that we are usually taught in school is kind of like, what does the patient want? It's very individualized, and as opposed to like community-based. And so, like I said earlier, there is value in individual therapy and helping them explore their issues individually. But for the Hmong people, that community, that kinship is very, very important. And I think if you just tell them to disregard that, would be kind of a disservice too.
Yeah, probably a disservice and an insult, frankly, to their historical culture. Wow, this has been really eye-opening, and I've learned quite a bit on how to help treat Hmong people and sort of the historical trauma that Hmong people have experienced. And again, forgive my ignorance. I mentioned it to you before this started. My only exposure to Hmong culture was in the movie Gran Torino, and I don't know how accurate that was, and I don't know. It's just I think I mentioned it too, that just sort of in media representation, there really isn't a whole lot out there with Hmong people in movies and TV shows and things like that. And it's like this whole culture that is not being acknowledged or looked at and talked about. So I really do appreciate you coming on and giving us a little bit of insight into the Hmong people and the Hmong culture. It was a really great presentation, and I really do appreciate you taking the time to be here. So
thank you. Yeah, it was a pleasure. And you're absolutely right. I think we talked about Gran Torino, and I mentioned that it was very hard for me to watch it when it first came out because And I really didn't know what the hesitance was or the fear, but I think it was kind of seeing myself on screen represented. And so it took me years before I could watch it. But yeah, there is more representation now. We have Suni Lee, who is the Olympian gold medalist for gymnastics, and I went to Minnesota, and they have some really award-winning like Hmong restaurants, and so it's nice to see all of that.
Oh, that's great. Hopefully we can get one here in California at some point.
I know it's not going to be me.
All right. Well, thank you, Dr. Yang. That's going to conclude this episode of the Licensed Ally Expert Series.